So hello guys, and welcome back to my channel. Thank you so much for clicking on this video. Remember that your click matters. If you are new to my channel, thank you. To my subscribers that are continuing to follow me, thank you. Okay, so if you are new, make sure that you subscribe to my channel. Yes guys, so today this video is going to be about breast cancer awareness. As you all can see, I have on pink, and then I have a little pink proud with my little breast cancer ribbon. Okay, so and to my subscribers that have subscribed, I'm now a little over 200. So I will be doing a giveaway, and I'm also going to be going live. So when I go live is when I will do the giveaway. Okay, so you all comment and let me know, excuse me, what is a better day for you guys next week, which is going to be either Friday or Saturday evening. I'm in California, so California time, of course, is Pacific Standard Time. So that's pretty much what I wanted to say. Let me know what will work for you better, Friday or Saturday. And today is October the 7th. So not this weekend, but the following weekend. If you have any questions, go ahead and ask in the comment section, and I will definitely leave the dates. Okay, so I'm going live for the first time so I can meet my subscribers and also do a giveaway to thank you, or a person, whoever wins. Okay, so once again, let's get straight to it. It is about breast cancer today. Breast Cancer Awareness Month, you all. It's October. Breast Cancer Awareness Month is from October the 1st to October the 31st, of course. Okay, it's very, very, very important to be aware about breast cancer. There are so many lives yearly that are lost, and I believe there's an estimated number of like 30,000 that will be diagnosed this year, or excuse me, next year. So every year there's an estimated 30,000 people will be diagnosed with breast cancer. Okay, so I have a grandmother on my father's side, grandmother on my mother's side, so maternal and paternal, they both did have breast cancer. So it's very important to get checked. I do get my mammogram. So what I'm saying is mammogram time, ladies, mammogram time. When is the last time you had one? Your insurance usually pays for one about every year. If you do not have insurance, make sure that you contact maybe the Susan Komen.org, I believe it is, or any type of like breast cancer foundation. Sometimes they can lead you to places to do free mammograms. Okay, so do keep that in mind. All right, so we're going to talk about so breast cancer is the most common cancer in women except for skin cancers. That's food for thought. Okay, why is it so important to get a mammogram? Well, it's very important that you catch it before it catches you. That makes sense, right? Yes. Men get breast cancer as well. It is rare because it's more common in women, but men do get breast cancer. Yes, they do. All right. So I'm going to talk about warning signs, and I'm going to give 5 warning signs of breast cancer. Okay. I'm reading because I've written things down to make sure that I stay on track, and also if don't have something in my head, to make sure that I have it right here. Okay, so 5 signs, 5 warning signs. Okay, lump in breast or under your armpit. Okay, that is a warning sign. Thickening of the breast or swelling. Okay, irritation or dimpling of breast. Excuse me, irritation or dumpling. Excuse me, I keep saying it wrong. Irritation or dimpling of breast skin. Okay, redness or flaky skin in the nipple area or the breast. All right, pulling in on the nipple or pain in the nipple area. Now, if you're nursing, that's usually pretty common, but if it's too uncomfortable, make sure that you do see a physician. Okay, also nipple discharge other than breast milk, including blood. Okay, so those are some of the signs of breast cancer. So if you're experiencing anything like that, make sure you go get checked out. Now, they do recommend that when you are in the shower that you do check your breast or do your own little check you know, by, it's just more, you know, lift your arm up and you're in the shower and then hold it, and then you go around and I just do this, you know, because if I do that, I can't feel anything to me. So I do this with my hands, kind of, because when I'm in there, or when I'm laying down at night, the same thing. And then this helps me to determine if there's any knots or any type of lumps in there that don't feel right, okay? Since my maternal and paternal grandparents had it, or grandmothers had it, I usually get checked every 6 months, okay? Just to be sure, because that's what they recommend for me, okay? Now, the most common type of breast cancer is invasive ductal carcinoma. 70 to 80% of all breast cancers usually is the invasive ductal carcinoma, okay? The most common, all right? Now, the most aggressive breast cancer, which is usually in African American women, okay? The most aggressive is the triple negative breast cancer. It's an inflammatory breast cancer. Its rare form of cancer is named because it causes breast swelling and redness, okay? So that's the most aggressive, triple negative. Now, I'm not saying that Caucasians don't get it, but it's very common in African American women. You know, it's just very aggressive, and that's why it's good to get your mammograms, because they can catch it before it gets too far, okay? They also have metastatic cancer, classified as stage 4, okay, breast cancer, because it has spread to other parts of the body. That's metastatic cancer. And remember, there's the triple negative, okay? And then there's the invasive ductal carcinoma. And these are things that you can get on the internet. Everything now is at the tip of our fingertips. You just press and you can pull up anything on the internet that you need to know about your body, or whatever you want to know, okay? Now, I pulled this off of there. It says, so let me see. It says, let me make sure that it's, oh, it says neither you or your doctor can detect it by hand with most breast cancers. Each division, because we have like the 28th cell division, so each division can take 1 to 2 months. So by the time you feel a cancerous lump, the cancer has been in the body for 2 to 5 years. That's crazy, right? That is so crazy. For 2 to 5 years by the time you feel the lump. And I guess that makes sense to me, I guess, because metastatic, that's the one that spreads to the body. So within that time, it usually has spread. But anyway, so that's just some food for thought as well, okay? Now, that it has been talked about better treatment in regards to African Americans and things like that. I know a couple people that have had breast cancer, and one person did share that she felt that her treatment wasn't as good as other ladies who she was going to the support group with. I've never experienced it, so I can't say. I'm just going by what someone has told me. I am in the medical field, so I do get different views from different survivors, okay? Now, we're going to talk about foods, free radical foods, okay? So foods that that can really aid in getting it. Now, I'm not saying that it's going to give you cancer. This is not what I'm saying, guys. I'm just saying in regards to maybe perhaps healthy eating, okay? So red meat, alcohol, cooking oil, and processed meats are not good for cancer, of course. A lot of people go get their chemo and things of that nature, but there's some people that have went plant-based and they didn't even need chemo and they were healed. Everybody's situation is different, but that's also food for thought, because plant-based can be a big aid in regards to getting rid of some of the toxins or poison that, or the cancers that are in the body, okay? Now, excuse me, foods to fight free radicals. Now they have tofu. Now they say 6 portions of vegetables and fruit every day. That's what they recommend, okay? Beans are a good thing. Beans are really good. I like lentils because it's such high in protein, all right? Fish is better than meat. Coffee and tea, and then raw vegetable oil, as far as like extra virgin olive oil, okay? So just some raw, okay? They also say red wine is okay, not white wine. But those are just some little small things just to share with you all. That's pretty much it. But like I said, there's some people that, have been stricken with cancer or breast cancer and have went to a plant-based, no meat, and have been cured. Like, wow. So pretty much what we put into our body can be a huge help in fighting any type of ailment or disease that we may have, instead of medication sometime. But I do know each person is very, very, very sensitive. So, of course, you have to do what works for you, okay? Enough of that part. So just make sure you're getting those leafy greens in on a regular anyway, your fruits and vegetables, okay? And just try to do better with our eating, because possibly it could help us, or it could prevent getting breast cancer. But you all, once again, I said in the beginning how I have my pink on. I have my pink on because I stand in solidarity with breast cancer patients who are still battling breast cancer. Also, the pink is for in remembrance to breast cancer patients that lost the fight to the breast cancer, okay? So this is Breast Cancer Awareness Month, and I just wanted to bring awareness. Everybody pretty much knows all about it. They talk about it all the time. There's probably commercials and ads and everything else to make you aware. Now, it doesn't mean that October is the month that you have to do it. You can do it any month. But just breast cancer is the Breast Cancer Awareness Month. So if you get it done in November, December, or whatever it is, hey, maybe you may call and there may not be an appointment. But what they're saying is pretty much just be aware and make sure that you are getting your mammograms. Mammograms save lives. Before they were doing the mammograms, so many people passed away. With these mammograms, they are able to save so many lives because they catch it way before it catches the individual. Okay, so that is pretty much in a nutshell of what I wanted to come on here and talk about today. Yes, that is pretty much it. I just want to definitely thank you guys for taking time to watch this video, for sure. If you like this video, you have to hit a like, of course. Also, make sure that you share this video, because sharing is caring, right? That part, exactly, yes. Also, make sure that you subscribe if you have not subscribed, okay? I really do thank you so much for your support, once again, for just clicking on this video. You all are so appreciated. Just remember to take care of yourself, because if you don't take care of self, you cannot take care of others. Regardless of if it's your children or your husband, we as wives tend to put the husband and the children first, because that's what moms do. We go in mom mode and we just totally forget about self. We don't take care of ourselves sometimes because our focus is our husband and our children or other family members, your mother, your father, whatever it is. But just remember to take time out for you, okay? This month is Breast Cancer Awareness Month, and it is all about you. So make sure that you go, and you and you and you and you and me and you, and tell your mama, tell your sister, tell your cousin, tell a friend to make sure that they go get a mammogram if they have not had one within the year. Other than that, take care, guys.